All right, well, good afternoon. Colonel Vince Myers here with the team from Blanchfield Army Community Hospital. We've got a variety of our deputies and senior leaders in the organization and our civilians, which are really critical to what we do. Just want to start this off just by thanking you guys for all of the support to get this project up and running. As everybody knows, last year we opened up our brand new ICU, state-of-the-art, and you all visited not long ago. Really, it's spectacular. One of the nicest, as a nurse, one of the nicest ICUs I've ever been in my experience. And so we really want to make sure, as we care for the nearly 70,000 beneficiaries and the third largest active duty population in the Army, that we keep people here in the ICU, in the hospital, versus sending them out to our network facilities. And without Naval Station San Diego and the team there at the medical center, we could not do this. And I know that everybody's put in a lot of work, both on your end and our end, to get us there. Really just done a phenomenal job to build this program. It takes time, but with like fine wine, when we get to that point where we're ready to go, we know that we're ready to go, and it's the safest and best quality option for our patients to stay here for those higher acuity needs. And as we both know, and I have two Navy mentors, candidly, that I talk to on a frequent basis. I have seen one of those, actually both of them, in the last 48 hours, and just had a chance to just thank the Navy once again for helping the Army to get after some of these critical skills that we have from a readiness perspective. This will truly allow us, as we partner with a lot of our network agencies locally, it'll truly fill in a lot of the readiness gaps and opportunities to build the ICTLs for not just Blanchfield Army Community Hospital, but the division, but also our field hospital partners. And we just finished our semi-annual training brief with the Medical Readiness Command East Commander. And one of the things that was common throughout that dialogue was the fact that multiple platforms come here for their training. Places like Fort Knox, places like Redstone, even further than that in other parts of the region across all the facilities. So this is truly a platform, and our mission talks about being a ready force and having a healthy future. And that healthy future is about the ability to be a platform to support training. And so I just want to candidly thank all of you and your team, because we know you have a lot of organizations that you're supporting, and we know that you squeezed us in when you really didn't have the space to do it, so we really appreciate it.
Well, thank you, sir, for those kind words. Again, we're calling from San Diego. This is Navy Medical Center San Diego, and this is the Virtual Medical Operations Center that houses our Tele-Critical Care element, which is the Joint Tele-Critical Care Network. And we've taken about 10 years to get to this point, and happy to say we're the Joint Tele-Critical Care Network. That jointness is clear, and that's reflected not just in us covering Army sites and Air Force sites now, but now having a component of physicians and nurses across the enterprise that are ready and willing to support our intensive care units. This really started with a fax machine between two MTFs and has blossomed into covering over 18 sites and over 120 beds across the enterprise, with plans to cover all MTFs. And we really look forward to not just being able to be there to provide that competency, that medical decision-making capability for your unit and others, but also to do what you discussed, is to be the element that helps to leverage that MTF to keep their folks on station, keep our soldiers, sailors, airmen, Marines with their units, with their families, and at the same time get exposure for our forces to improve their case mix and complexity and KSAs, and perhaps even get so far as start to standardize a lot of the ICU practices to raise the tide so that all ships and all elements can operate with the same degree of competency, so when we do deploy together, we're speaking the same language. So we're really happy that we're able to get in there at Blanchfield, and really appreciate the assistance from your staff and your leadership to get us on board. And we think that this is going to be something that will hopefully enable you to perhaps have some more expansion with the forms of military-civilian partnerships and assistance with the VA patients in the region, and hopefully get to the point where you really have a full ICU. I mean, as much as that kind of sounds crazy, that's really our hope, is that we can get that exposure to complex injured patients to improve our prolonged casualty care capabilities for the enterprise. So I just want to say thank you again. You guys gave us a very warm welcome when we were out there, and we're certainly happy to be part of the team.
We appreciate it very much, and I think you spoke to it. Our VA partners I actually had a chance to meet with Dan Deeker, the Tennessee Valley VA director, over the past couple of days out in Chicago, and Dan is very excited to bring more VA patients into the facility and continue to bring that volume of readiness. And like you said earlier, as a nurse, you never want to see a full hospital, but as a nurse, you want to see a full hospital, right? Especially as a commander, you want to see a full hospital too. But again, we want to be that choice for our patients. And our patients don't want to travel, candidly. They want to be here. They want to be here at Blanchfield. They trust us. Our staff is amazing. We are truly a team of teams. Me in this room by myself does nothing for this organization. This group here is just amazing, continues to knock it out of the park every single day. So along with the VA, I just want to really thank both the Medical Readiness Command East for their focus on readiness and the Defense Health Agency and Dr. Brian Line for his support of this, because he was the one that really started to press and say, hey, let's get this done, let's get it moving. And as a team and as partners across the Joint Force, it's really critical that we leverage all of our assets, because candidly, there's not a lot of capital to start building assets in every location. We've got to leverage the ones that are out there. And we just can't thank the Navy enough for the support for the Army here at the deck plate. I told Christina that I would add one Navy comment along the way, so that's it right there. So at the deck plate here in the ICU, we appreciate the support and could not thank you enough.
We're happy to do so. Appreciate it.
Well, enjoy, and thanks again for all the support, and we look forward to this continued partnership and the growth that it's going to bring us from a readiness and patient support standpoint.
Aye, aye.
Fair winds and following seas. Now, hey, we appreciate it very much. Thank you.
Thank you, sir.
Definitely going to have to make a site visit out there, of course.